All right, back here at First Intermission at Caps and the Islanders here from Nassau Coliseum. And joining us here is Dr. Estelle Jean. She is a cardiologist with MedStar Health. And Estelle, we have a very big conversation to have here, and it's a very important conversation given what's going on in the world, and that has to do with COVID-19. I want to lead off by asking you, so many people are looking forward to seeing their family members again, and it's obviously a big motivator why many people want to get the COVID-19 vaccine. There are other reasons to get the vaccine as well. What are some of the things you're hearing from patients about why they are excited to get vaccinated?
Thank you so much for having me on today. Yes, COVID definitely has impacted our lives significantly over the past year. And for many patients, that meant that they haven't been able to see their family. Grandparents have not been able to hug their children or see their grandchildren. And so by far, that definitely has been one of the things that they've been looking forward to for a simple hug or a brunch or family gatherings such as birthdays. You know, many milestones weren't achieved last year through the regular traditions. And so they're definitely looking forward to attending some weddings and traveling and hopefully one day going back to some cruise vacations, which many of my patients enjoy. And another thing, they just are looking forward to seeing their doctors in person because many of them have been a little afraid to come into the office due to concerns of getting COVID. And so now they're looking forward to having some normalcy and regular routines.
I saw a stat yesterday that said that 91 million Americans have been vaccinated, which is great, but obviously there's still a road ahead. Happy to say to Caps Radio crew, we are 100% vaccinated on this end, but for those that have hesitations, how do you respond to patients with concerns, or what would you like our audience to know to encourage others to take that next step and take the vaccine?
Well, that's fantastic that you guys have had such a great success getting everyone vaccinated. You know, the thing is, for us to achieve herd immunity, it's estimated about 70 to 85% of the population would have to get either natural infection or vaccination to achieve that immunity. And so therefore, vaccination is really proving to be the most effective and safe way of achieving that goal without additional unnecessary death. And, recent data from the CDC has shown that more than 80% of the deaths are occurring in patients above the age of 65, and 95% are occurring in those above the age of 45. And unfortunately, in minority patients, those numbers are different because of healthcare disparities. Many times, younger minority patients are developing severe illness and more likely to die due to underlying medical conditions. And so that's why vaccination is so important, because as we're working to treat the underlying health conditions, vaccination is that way to help get us there and again, back to some normalcy so that we can finally start to open back up. And then another important thing that comes up is we don't really know the long-term impact of COVID. So I take care of a lot of patients who just had mild symptoms. You know, they didn't end up in hospital, but yet they have lingering foggy memory, and they feel tired and drained and have ongoing shortness of breath and dizziness. And again, these are classically the patients you wouldn't necessarily think of getting severely ill, but their quality of life is being impacted several weeks and months after getting COVID. And so that's why vaccination is so important, because you can avoid some of the lingering long-term effects of the COVID infection by getting vaccinated.
Many of us have heard by now, the CDC says that it's safe for groups to gather indoors as long as everyone in the group has received the vaccine. Are these recommendations a game changer for people who still may be on the fence about getting the vaccine?
Yeah, it definitely is. And again, just, spring is here and summer's coming. And so having the opportunities to potentially have small gatherings for, barbecue with friends and family. Because one of the things that I'm seeing in my practice is the impact of the social distancing and isolation that can happen. And so mental health is physical health. So the more that we're getting back into these routines in a safer environment with other vaccinated individuals, the more that we can continue to move forward and address many of the ongoing mental health issues as well as the physical health issues. And then another key is that now there's also been changes to flying and traveling domestically, where you don't need the quarantine after vaccination or getting tested before and after travels. But of course, it all depends on your local area. But based on the CDC, you have more flexibility and freedom to travel domestically once you've been vaccinated.
It's been a long year. The Capitol is going to have fans back in the building for the first time on Tuesday since March 4th of last year, which we're all excited about. But Last question I've got for you. Do you believe there's a light at the end of this COVID-19 tunnel, and are the vaccines part of that?
I do. I do. Now, there's still a lot that we're learning about how long the immunity lasts and the variants. We still have to figure out how effective the vaccines will be. But the great thing is the various manufacturers are working on potentially getting additional booster vaccine in the future. But yes, in order for us to get through this safely with, less deaths, vaccination really has to be part of that equation. And so the more patients that get vaccinated, and especially in many of the communities that may have had some reservation initially, the more that we can finally work towards and seeing the light at the end of the tunnel.
Well, here to all of that. Dr. Estelle Jean, cardiologist with MedStar Health. Thank you so much for joining us for this.
Great. Thank you so much for having me this evening.